Hello, everybody. This is Farahati. This is the last lecture in our health economics class. This is the final review of the United States healthcare system and global healthcare comparisons from an economist's perspective. Lecture 1, Market Analysis. The objectives of this lecture is to summarize the United States healthcare system with respect to the health insurance industry, physician services industry, hospital services, pharmaceutical industry, and basically overall healthcare economy, and compare it to the other high-income countries with respect to the triple aim. The key questions we wanted to answer in this course and basically in our healthcare system, nationally, internationally, is what is the best care and payment models to achieve the triple aim. Suppose that you have been appointed to the post of Surgeon General of the United States. The President wants you to outline and justify a proposal for national health insurance. And so in your proposal, you have to discuss the following elements, basically. Who should be included basically as a beneficiaries? Do you want it to include everybody as a universal health care? And what should be included? Benefit package. Do you want it to include only hospitals, like the old days, or similar to the Affordable Care Act, you want it to include, basically preventive care and essential benefit with the addition of dental and mental care and integrated into the medical insurance instead of being a separate plan, right? You have to basically determine and you have to justify why this is best. And also you have to determine how you wanted to finance that. Do you want it to finance that like similar to Canada? Everybody pays for basic health insurance via a health tax, or you want it to basically cover it like what we have in the United States currently, is basically by multi-payer system. Now, also you have to determine whether you wanted to give this option to the provider to deliver their own services separately, or like the UK, you wanted to actually hire them, employ all the providers and basically deliver take the responsibility of the delivering the healthcare system from a central basically system. Also, finally, you have to decide about who sets the rules. Do you want it to give the basically choice to the providers and patients, consumers, basically as a basically private sector, to have a private sector competition to assure the most cost-effective medical care, or you wanted to basically have a central, basically federal government to set the rules for everybody. Now, by the end of this lecture, you have to decide. Of course, there is no one single answer, but when you answer your choice, you have to justify why that's the best case, right? Okay, let's start. To decide about what is the best model, you have to study the current cases. What do we have right now with respect to these three elements that we talked: financing, delivery, and regulation? So three common, essential, and deeply intertwined elements which are critical to our healthcare success, determine basically the situation of our healthcare system. With respect to financing, just think about that. Right now, currently, who pays to whom, how they pay, how much they pay, and what they pay for. It's difficult to say because we have a multi-payer system. So in the United States, healthcare is financed or paid for in a variety of ways. It depends on what category you are. Um, so the biggest actually group is under the employer sponsor insurance, about 160 million people, non-elderly. And then we have the individually purchased coverage insurance, and we have the 1/3 of the population, they have a government related insurance such as Medicare, Medicaid, and VA. Of course, we have uninsured, about 29 million people, they are uninsured and they don't have any insurance. So of course, if they are uninsured, how they pay? Definitely they have to pay out of pocket if they are not included in the Medicaid, and or if they end up to the emergency room, then the government have to pay that, right? Regarding the delivery, what care is provided to whom and by who, again depends on what coverage you have. We have a private and public providers, including the hospitals, physicians, nurses, technicians, etc. And regarding the regulations, who sets the rules and what rules do they set? Again, depends on what group are you. So we have a both public and private organization to set the rules, and also these rules varies across geographies and populations. Now, remember that when we wanted to analyze the market, we use these three elements of market structure, conduct, and performance to determine what type of market do we have. So specifically, we are interested in healthcare. Do we have a perfectly competitive market, or there is a market power in healthcare in the healthcare system? So to determine that, we have to look at the number and type and size of the market share, and whether there is the information, perfect information for both buyers and sellers, or providers and patients, and if there is a barriers to entry. And also we have to look at the pricing behaviors, and of course the objectives of the market, whether basically the industry is a profit maximizing or quantity maximization, or quality maximization, that actually affect both market structure and conduct, and also public policy such as taxes and subsidies, and price regulations affect the market structure and conduct. And all these factors determine the performance of the industry in the market. So if you remember that in the previous lectures, we use this kind of a scale from the Department of the Justice to determine whether our healthcare system is actually considered as a perfectly competitive market, or has a pure monopoly, or something intermediate, basically market here. To determine that, we have to look at these characteristics, to look at the number of the sellers or number of the providers, and individual firms' market share, and then type of the product, and barriers to entry, and buyers' information. In healthcare system, so depends on who you're looking at. For example, if we are talking about the providers, for example, internal medicine doctor, we have so many internal medicine doctor, right? There are so many of them. But we don't. If you are talking about the hospitals, especially in a small, basically city, maybe we have one hospital that is monopolizing the market, or the patients, they don't have any other choices to go to that except to go to that hospital, and the hospital has the 100% market share. Of course, the products are homogeneous because there is only one supplier, that hospital providing the total production. And so the information could be perfect or imperfect, doesn't matter. because the consumers or patient, they don't have any other choices. Now, in reality, we don't have a perfectly competitive market, and basically it's the ideal choice because in perfectly competitive market, there is a optimal allocative efficiency for production and consumption. And in the other extreme side of the spectrum, we have a welfare losses. So we try to have, so the best market basically is the perfectly competitive market. We are trying to have a smaller market power, so to give the choice to the consumers. Um, so the competitive competition always makes the market better because you compete to have a higher quality and lower prices. So, so the question here is that uh, let's see from the previous slides. Let's have a test. The question is asking barrier to entry are not present in which type of industry. So definitely only in perfectly competitive market there is no barrier. So in the other market we have some barriers. In lecture 8 you learn about the so whether perfectly competitive market is relevant to the medical care. So we have to look at these characteristics we talked about. First, we have to look at number of the buyers and sellers. Do we have so many buyers and sellers in the market? Definitely depends on who you are talking about. Again, when we are talking about the sellers or providers, so we have so many internal medicine physicians, but we have a few number of the hospitals. So the hospitals could be price makers, but most of the internal medicine doctors, they are price takers, right? So then we look at the market share. Definitely the internal medicine doctor has a small market share, right? Means that can have all the patient in one, say that in one city, but there are possibilities if there is only one hospital in one city to have a 100% market share, right? The type of the product could be homogeneous or differentiated, again depends on what type of providers you are considering. And barriers to entry, definitely there are barriers to entry. Even if you wanted to be in internal medicine, you have to study years and years to get a license for practicing. And also the buyer's information is not perfectly available for the patients. Usually the providers, they have more information about the available treatment and the best treatment for the patient than the patients by itself. Now, you learn about these graphs, which is a model of supply and demand, which we use to predict the changes in the price and quantity of goods and services in a perfectly competitive market. So we have a price per unit in the vertical axis, and we have the quantity of the medical care in the horizontal axis. The demand is downward sloping, which shows the diminishing marginal utility, and the supply is upward sloping, which shows the increasing opportunity cost by increasing the additional basically production or additional, for example, in this example, tablets of aspirin. The intersection of demand and supply determines the equilibrium for the price and quantity, right? This is basically simply the simple version of what we had. Now, in a comparative static analysis, we use this supply and demand, and then we actually show the changes in the market condition. So could be influence the options of demand and supply curve and change the equilibrium. So those are the factors we wanted to know. What factors change the demand and supply? Factors that change the supply could be input prices and technology. For example, if the wage rate for the nurses increase, this nurse is input prices for the medical care, right? This increase the cost of production of the medical care and shift the supply curve to the left. Or decreasing the wage of the nurse could increase the production and shift the supply to the right. The factors that change the demand would be number of the buyers, consumers' taste, income, and the prices of substitute and complements. So, for example, when we say number of the buyers, factors that shift the demand curve, if by aging population we have increasing demand for medical care, so means that the number of buyers for medical care increase and shift the demand to the right. Or, for example, if the consumer's taste for technology, for example, say that increase, for example, all the patients over the age of 65 are interested to have a knee surgery, knee replacement surgery. So this is basically shifting the demand for knee replacement surgery to the right. By increasing the demand, by increasing the income, the demand shift to the right. By decreasing the demand due to the first, for example, recession, shift the demand to the left. The prices of substitute and complement impact the demand as well. For example, if the price of the outpatient increase, definitely the patients, they don't go to the outpatient when they are basically they need it, and they wait and until they actually go to the hospital. So that's basically kind of substitute, and the complements are, for example, if the study shows that social workers are complements for the psychiatrists. So increasing the price of the psychiatrist decrease the price for social worker. Now, so basically the greater number of the buyers and the greater buyer's income increase basically the price and quantity. So when we have higher income in our society, this shift the demand to the right, and that actually end up to the higher price and higher quantity. And cost-saving technology shift the supply to the right, and rightward shift of the supply to the right decline the price and increase the quantity. So this would be easier to see by looking at the graph. In this graph, you see the effect of an increase in supply adoption of cost-saving technology. The cost-saving technology means that, for example, type of the technology like computer, adding computer for more computer to each hospital, shift the supply to the right, and the equilibrium price from A at the beginning moves to B, and at this price there is a excess actually supply of AB, and this actually gives the signal to the buyers and sellers here, to the sellers to decrease the price up to this point, up to the P1, and at this price P1, the consumers are increasing their demand. So the second equilibrium would be from P0, P and Q0 to P1 to Q1. So this is the rightward shift of the supply curve due to the adoption of cost-saving technology. There are two types of technology. One is cost saving technology, which is shifting the supply curve to the right, which is decreasing the price and increasing the quantity. The other type of the technology would be cost enhancing technology, which basically shift the supply to the left, which increase the price and decrease the quantity. The effect of an increase in supply, adoption of cost-saving technology. Now, suppose that we have the rightward shift of the supply due to the increasing computer in hospital. So, if, initially we were at the point of A, and then we moved to B by rightward shift of the supply curve from S0 to S1, and then the market said that there is an excess supply here, AB, so the suppliers, they have to decrease their price to point C. Now, the second actually change would be a rise in real income, which shifts the demand from D1 to D2. So therefore, we move from A to B by shifting the supply from S0 to S1, and then we move to C, and by shifting this demand from D0 to D1 because of the increasing the real income, so we move back to the point B. Now, the final actually effect depends on the size of the shift. So if the size of the shift of the demand is greater than the size of the rightward shift of the supply curve, then the final actually point of the equilibrium would be at P2, P3, Q3. So means that increasing both price and quantity. But if the final shift of the demand was from D0 to D1, then so the price actually would be unchanged, but the quantity will be increasing from the Q0 to Q2. So this is basically dynamic analysis. So it's basically in dynamic analysis, we look at the long run entry and exit in a perfectly competitive market. So we consider dynamic actually effect by long run entry of the new firms. If there is a profitable market in a specific market, then the new firms enter to the market, and there will be shifts of the short-run market supply curve to the right, and that rightward shift of the supply decrease the price and eliminate the excess profit. So in the long run, exit of an existing firms shift the short-run market supply to the left and raises the price and eliminates the economic losses. So this is the dynamic analysis. Means that you also consider whether with the high profit there is a new firm entering to the market and shifting the supply curve, or because of the lack of profit, the firms are exiting the market, so shifting the supply curve to the left as well. In chapter 9, you learn about the government involvement. So one of the main factors of government involvement is externalities. And there are two types of externalities. One is the demand side of externalities, and that also categorized to positive externalities and negative externalities. Now, the positive externalities means that the marginal social cost is greater than the marginal private benefit, such as like vaccination. So when you have a flu vaccine, you have a vaccination for flu, so this actually prevent even from prevent the people around you to have flu from you. So that's basically is a positive externalities, and there is a negative externalities such as cigarette smoking, which the marginal social benefit is smaller than the marginal private benefit. Um, so in that case, we need a government, for example, to subsidize the vaccination and impose tax on cigarettes. The supply side externalities, the best example is the pollution, which created from a production process, and basically the people, they don't consider the external negative impact from their production in the society, such as pollution. So in that case, again, we need government intervention, right? So here is an example of a question. What is the role of government when external benefits or costs occurs? So is that the government should not become involved in the market and should leave it up to the market participants to settle any issues? It's basically, we are talking about the invisible, Adam Smith, invisible hand, or the government should provide subsidies to those with low income in the case of external costs, or the government should require producers who impose external costs to reduce their output and increase their output in the case of external benefit, or the government should calculate the magnitude of the external cost and use subsidies and taxes to achieve the right rate of output in the affected industry. Which one do you think is the best answer, right? So definitely the last one. This is the end of lecture 1.